Brother Nabi, we are all set to go.
Yes.
Assalamu alaikum and hello to everyone, to all our viewers on YouTube as well as on the Facebook Live. We are here together with part 3 of our COVID medical seminar. I'm extremely thankful to Brother Nabil, who's our backbone in the IT, to really help us conduct this seminar very well. We are in a virtual studio and hopefully you all are having no difficulty in joining us. Just few housekeeping rules that you will be sending your questions via live chat or comments through YouTube as well as through Facebook, whichever is convenient for you or where you are logged in. We will have those questions answered appropriately as we go through our panelists. I'm extremely thankful to all our panelists who have joined us. You can imagine that this is their family time. They will be with their family. We all are in isolation, but still you don't want to steal from their family time, but they were kind enough to really agree and be part of this. We have an esteemed panel of participants here. We have Congressman Jim McGovern from 2nd District. We have Dr. Dickson, our CEO and President for UMass Memorial Healthcare. Dr. Ellison, Professor of Medicine and Infectious Disease Specialist at UMass Memorial. Dr. Waqas Qureshi, our cardiologist, who unfortunately recently passed through the COVID exposure himself, and will give you a first-hand account that how his experience was, and also will tell you about the cardiovascular medicine and how cardiac system can be affected by COVID. And at the end, we'll have Dr. Asif Hirani, our Imam, who will give some spiritual guidance and how to have some spiritual dua and activities which can also help to make you strong, and I'm sure to help your immunity also. So without wasting further time, we are going to start. I'm going to begin with our Congressman Jim McGovern, Congressman from 2nd District. Hello, Congressman.
Hello.
Very much. I know he told me that he literally drove earlier today and just arrived home, but he still was committed to participate here. He has been very active for our community, for his district also, and overall, whatever he can do in these tough times. These are unprecedented times, as you can all imagine. You know, recently our people and friends from other faiths had their Easter holidays and no activities, no services which they could be together. Similarly, our friends from Jewish faith, they had their Passover but couldn't join. Next, we will be starting Ramadan actually, and we'll be facing the same situation. But the most important part is that how we can contribute as a community to stay away in isolation with social distancing so that we can save lives. That's our contribution really, even though we are not directly involved, but that is a big help which we can provide as a society, as a community. So Congressman, I'm going to ask now you to join and take the podium and to go through this virtual conference seminar and to give us your perspective, how your activities have been, how you have been helping our community with the COVID pandemic. Did we lose Congressman? I saw his video was there. I'm just going to wait and hopefully he'll come back on. Something must have happened. So while we are working on the technical glitch, something must, I'm trying to see if, I think the video is coming on. Maybe Congressman will be joining us shortly. Brother Nabil, if not, then should we go ahead with Dr. Dickson, or are you with from Dr.
I think
are you able to see if Congressman has dropped off or something happened?
he dropped off, but let's give him 10 seconds. He might be joining back.
He must be, because he was with us, and something, I hope it's not, you know, the computer going without power, and that can happen also. So while we are talking, I think I should at least to talk about our panelists in the meantime, and then it can cut down on the time later on. Dr. Dickson is our CEO and President from UMass Memorial Healthcare. UMass Memorial Healthcare, as you know, is one of the largest employers of Central and Western Massachusetts, and one of the top employers. He has been really providing us a great leadership in these tough and unprecedented times, where our physicians, our healthcare workers are all looking for leadership, how to really participate and to serve our community and be at the front lines. And that's where you want to have a role model, a leadership who can guide you in a better way. They have established the field hospital at the DCU also, thinking the need of it, especially there has been rearrangements inside the hospital system, which we know, so that, you know, the search with our COVID patients can be easily managed and addressed. Dr. Ellison is our professor of medicine with infectious disease expertise. He, in fact, was literally joining us while having his dinner. So thank you very much, Dr. Ellison. I know, again, this is a time when you should be with your family, but you are with us. Dr. Qureshi is our cardiologist from the community. He's on call, they told me, but he managed, hopefully, to get coverage so that he can participate and give his perspective that how he went through, with the COVID exposure itself also. And then at the end, of course, our Imam, Dr. Asif Irani, will be talking. It seems that the Congressman has still dropped out, so maybe we should go ahead with Dr. Dickson. Dr. Dickson, you can hear me, and are you okay then in that case? Oh, let's see.
I can hear you. Yeah.
Dr. Dickson, it seems that something must have happened, and I'm sure the Congressman will join again. So I should, before I pass on mic to Dr. Dickson, I should thank him and acknowledge his services for our community in general, but also helping us at WIC Free Clinic at our center at Worcester Islamic Center. So thank you very much, Dr. Dickson, for helping that. And also in the past, UMass Memorial has been giving us that parking lot, which our community used to talk about FedEx parking lot, which in fact was UMass Memorial parking lot on 100 Century Drive. And now it's part of the Hospital for Behavioral Medicine. So many thanks for facilitating that also. And in general, always being for the community. So please proceed and give us
So much
how...
and seeing my family, which I haven't got to see too much lately because of the hospital and as busy as it's been, but it's very much appreciate the opportunity to address you and to thank you for all of what you're doing to help stop the spread of this awful virus. And I know we'd all rather be together and talking in person about this, but the circumstances just don't allow that right now. I also want to say a special thanks to some of the caregivers that are on tonight. Many of you, I know there's several physicians on tonight, and nurses, dentists, first responders. This is our calling in life to take care of the sick, and this is probably a time when we've been called upon the most to really reach deep down inside in our inner spirits and help our fellow man. So I want to say a special thanks for that. Coronavirus is a sneaky, malicious opponent in that it spreads amongst the community, has a long incubation time, and it chooses people, so to speak, that it will infect with mild symptoms, and then weeks later, it causes life-threatening and sometimes lethal illness in a few. And it is only because of that ability to cause mild illness or have asymptomatic carriers that it can spread so much in a community that weeks, 3-4 weeks after it's primarily spread, you see the devastation that it's actually caused. And right now we're seeing that devastation in central Massachusetts. What has happened in other areas of the world and in the country is that the burden of disease has become so high that it outweighs the capacity in a healthcare system. And certainly in New York, that was the case. In Italy, that was the case as well, such that you can't deliver the standard care that you would to patients coming in with this horrible lung infection. And when that happens, you see a mortality rate in communities go much higher than it otherwise would. So our strategy has been here in central Massachusetts to make sure that we have the capacity in healthcare, the intensive care capacity, the acute care capacity, the emergency department capacity, such that we could always keep up with the burden of disease as it was coming in. And we've done a lot of things specifically to try to address that. We've doubled our ICU capacity and could, from what was 120 beds typically for our medical center, to about 240 beds across the healthcare system now. We've taken the DCU center and 50,000 square feet of empty space, and we've put in a 200 and 16-bed field hospital with 6 ICU beds, which are being used quite extensively tonight for a special population, the homeless, that where the disease seems to be spreading fastest. We've taken Beaumont, the skilled nursing facility, in cooperation with them. We've created an entire skilled nursing facility that is just for COVID patients. And so to date, our strategy in terms of increasing capacity, reducing all the elective surgeries, has really kept us at pace with the burden of disease. We have about 250 patients in the hospital right now that have COVID-19, the disease associated with this novel coronavirus, and we still have some capacity in the hospital. So as long as that number doesn't get beyond 400 patients or so, we're going to be able to keep up. And I have to say that there's been a lot of bad things that have happened because of coronavirus, but the good things have been absolutely amazing. The spirit and engagement and the will of the people that I work with and other healthcare systems around the state to come in every day and try to make a human connection through a mask and through goggles and through those blue gowns that we have to wear when we're in isolation with the patient suffering from a COVID disease. The way the city and St. Vincent's and UMass Memorial and Milford and Haywood and Harrington have all come together to work together. Everybody seems to have put aside their petty differences to achieve a common goal, and that's to save as many lives as we can from this horrible scourge that is COVID-19. And I think what will emerge from this in the end, and I think we're in the peak zone right now. The last 3 days, we have not seen an increase in the number of inpatients. And I just, I pray that as we come out and we're through this, that we all remember how much we can accomplish when we work together in this community for a common cause. And so I'll stop there and just say thank you again for the opportunity to speak with you and for all that you are doing to help us stop the spread and to take care of patients.
Thank you very much, Dr. Dickson. No, I know this is a very collaborative and concerted effort, as a community, as a society, as a whole, that how we can tackle this invisible enemy, which you rightly said. Our physicians are the soldiers right now on the front lines, dedicating their time and literally their lives also. So let's hope that we all are safe and pull through this in a better way. We will save the questions for you at the end. And Congressman Jim McGovern has joined back, so I will ask Nabil to put Congressman McGovern. Thank you very much. Something must have happened. So
thank you very much. I just got a new laptop and I forgot to plug it in, so that's what happened. I get disconnected. Now it's plugged in, so I'm sorry for that. Let me thank the Worcester Islamic Center for sponsoring this, and let me thank all of my friends who are on the panel here. These are extraordinary times. And I know there's a lot of anxiety all throughout our community, all throughout the country. We have never seen anything like this in our lifetimes. And we're in a period now where we're trying to protect people, we're trying to save lives, but we're also trying to keep our economy viable so that when it is over with, we can get back to business. And we know that it won't be all at once. You're just not going to turn on a switch and everything's back to normal. This is going to be a gradual thing, and we're going to need to continue to follow the advice of people like Dr. Dickson, the other medical professionals who you have on this panel, and our scientists. We need to listen to them. Quite frankly, we need to listen to them more than the politicians, because they're going to tell us what we need to do to continue to bend the curve. They're going to tell us what to do so we can continue to be safe. And we can get beyond this. And our hope is that, we're going to continue to invest in medical research and ultimately find better treatments for this. I mean, there's some promising things that are being talked about right now, but ultimately a vaccine. we can, one of the, Dr. Dickson talked about some good things that have happened. One of the good things that has happened in the midst of this terrible struggle that we find ourselves in is that actually Congress is working. Democrats and Republicans have come together and passed 3 packages that I think have helped deal with some of the immediate concerns. The first one, the coronavirus package that Congress passed, was called the Emergency Coronavirus Preparedness and Response Act. And this bill committed more than $3 billion to the development of treatments and a coronavirus vaccine. We're going to probably have to do much more than that. $2.2 billion for public health funding for coronavirus prevention, preparedness, and response, and $7 billion in low-interest small business loans, and an extended telemedicine for Medicare patients. I mean, that's important because we don't want people coming into the hospital if they don't have to in the middle of this crisis. The second stimulus package that we passed was called the Families First Coronavirus Response Act. This bill included free COVID testing for everyone, including the uninsured, better employment insurance for employers, paid emergency leave, and it strengthened food security safety nets and school meals. Now, the reality is we still have a problem with making sure that the tests are available for everyone in this country. I think, our mantra ought to be testing, testing, testing if we're going to really get this under control. But nonetheless, when you get a test, this will help deal with the cost. And most recently, we passed a third stimulus bill called the CARES Act. That was in late March. And that bill included additional financial support for healthcare providers, additional small business loans, financial relief for colleges, universities, and students, most notably direct payment checks to working class Americans, many of which have already been dispersed. At the moment, we're now working on a fourth stimulus, which will plus up the recently passed CARES Act, and that's one of the reasons why I drove back to Washington today, because we need to not only plus up that account, we need to make sure that money is going to small businesses as well as big businesses, and we also need to do it more to deal with issues of food security. More and more people are in need of SNAP. We need to increase the minimum benefit for that program so that everybody has enough nutrition to meet their daily needs. We also need to make sure that we are doing more for our hospitals and providing personal protective equipment. One of my frustrations has been that as a nation, we are not terribly coordinated to deal with these kinds of pandemics. I've likened the struggle for hospitals and states to get personal protective equipment to that movie, the Hunger Games. I mean, we're competing against other states. We're competing against the federal government. Even when you think you may have a source that might provide personal protective equipment, we've now known the federal government has come in and intercepted that to use in other parts of the country. We get calls, and I'm sure Dr. Dickson gets calls from people who say, I know somebody who knows somebody in China who has, N95 mask, and, pursue that lead. That's not the way it should work. And the way this country should work in times like this is that, we identify the crisis, we do an inventory of what we need. The governor calls the president and says, this is what we need. And then the federal government provides it. And if we don't have it, we invoke the Defense Production Act and we make whatever we need to make so that nobody has to be without personal protective equipment. I'm bothered by the fact that many of our healthcare professionals and our first responders are using their protective face masks over and over and over again, when there was a time when they would use it once and then discard it. We're the United States of America. We can do better than that. We are working on this fourth package right now. And that we're going to probably have to work on a fifth package and maybe even a sixth package. And then we're going to have to deal with the recovery. So we get through this crisis and we respond to the emergencies. And then we're going to figure out how do we rebuild our economy. We're going to need to pass a massive infrastructure package. We're going to need to invest more in state and local governments. We're going to have to do more to help our small businesses get back on their feet. And there's a 1,000 other things we're going to need to do. But let me just close with this. I know many of you, have been affected in this and by this in many different ways. If you think that you may be eligible for some of the government benefits that have been enacted, please call my office, 508-831-7356. We're all, working remotely from our homes, but we're taking everybody's calls. We're responding to everything. If you're having a problem with the SBA, call us. We can help try to accelerate the process. If you can't get through somebody on unemployment, call us and we can help you with that. The other thing is, go to my webpage, McGovern.house.gov. We are constantly updating the latest news on what is available to deal with this coronavirus crisis. Again, I just want to say I'm really proud of our community, because our community, the greater Worcester area, has come together in a way that not every community across the country has, and we have a lot to be proud of. And I'm proud of everybody who's stepping up, not only our healthcare professionals and our first responders, but the people who are working in our grocery stores, the people who are providing meals for our kids, the people who are working in our post office. I may go on and on and on. And there are so many people that are doing incredible things during this crisis, and all the volunteers. And so I thank you very much for this opportunity to be with you. And again, we stand willing to help you in any way we can. Thank you.
Thank you very much, man. This was wonderful. I know you have been very active and doing great work for us in DC, and hopefully, you will continue on. And the government is under a lot of pressure, so we all have to put together, irrespective of what party we belong to. But this is the cause where we have to put our hands together. So thank you again. There are a few questions, but I'll hold up. I'm going to now pass our podium to Dr. Richard Ellison. Dr. Ellison is our professor of medicine and infectious disease expert at UMass Memorial Healthcare. So he is right into it. He guides us. He puts the policies for us. So Dr. Ellison, please give us a perspective and how we are doing with the pandemic, what we should do more, and where we can help each other.
No, thank you very much for the chance to participate in this evening. So let me just get back and make a couple comments about what we know about what's happening today. All of you are aware of what's happening in terms of what's happened in New York and other parts of the United States, which have been very severely impacted by the virus. In terms of what we know about it on a clinical basis, as Dr. Dickson said, what we know about it now is findings which are seen in China are very much the same as what we're seeing here in the United States. This is a virus which about half of the people who get exposed to the virus at all ages are completely asymptomatic. And about 40% of individuals, they'll have a illness which is can be very, very uncomfortable and very exhausting. And Dr. Qureshi will be talking about his own experience, so he can go into much more details about it. About 10% of people we're seeing are going to end up having to be hospitalized. If you look at people in the hospital, though, there's a very much skewing of the age population, and majority of individuals who are very seriously ill and in the hospital are those over the age of 55. About half the people in the hospital over 55, and about a third are over 65. Majority of individuals that will stay in the hospital actually do well, will not require extensive treatment. A small percentage, somewhere around 3 to 4%, end up being in intensive care units, and only about half of the people in intensive care units will have to go into a ventilator. And your first thought would be saying, well, that's not very many people. Why is it such a big impact? And the fact is that this virus has been so extensive, and when it comes into a community, spreads so quickly and so wildly that that small percentage of individuals can be enough to overwhelm the healthcare system. It does seem that this can spread quite quickly, and one individual who has infected with this seems to be able to spread, in fact, 2 or 3 other people within just a few days. And most of these individuals can then walk around and potentially infect other individuals. It does seem from what we know now that potentially the biggest risk of infecting other people is really in the day before someone develops symptoms till about a day after they develop symptoms. And after that, people are feeling pretty awful, not going around and spreading the virus as much. But if it goes into a community and infects, you suddenly have 100 people being infected all in the same 1 or 2 days, those numbers escalate and leading to the problems and having the impact and overwhelming the healthcare systems. And that's why social distancing is so important. By doing this, spreading things out in terms of having fewer people getting infected, it decreases the risk that we're going to have multiple people showing up in the hospital all on the same day. Doesn't mean we're going to actually get away from actually having many of us getting infected, but if it leads to people, not all of us are infected at exactly the same time, we're not going to have a big surge or a big impact in the healthcare system, such as was seen in New York City right now. It is very clear that this virus can spread in terms of people asymptomatic. And one of the things which has been recently very clearly shown is that the risk of transmission is really markedly impacted by someone wearing a mask. A mask is pretty partially protecting each of us from getting infected. It also protects us from, because it's covering our nose and mouth, you tend less likely to touch a surface, pick up the virus from there, and then touch your nose, your mouth, and put the virus there. It seems that the virus most likely gets into our body either through the nose, the mouth, or the eyes. So by avoiding touching those areas of the body with a mask on, that you're protecting yourself. Also, at the same time, if someone is wearing a mask and they begin to develop infection with the virus, they can then begin to cough and breathe it out into the air. And if you're wearing a mask, much less of the virus gets into the air. And so you're protecting the rest of your community, you're protecting your family, you're protecting coworkers, you're protecting everyone else when you're taking opportunity wearing a mask. So it's why it's really very, very important that as we also do social distancing, we also all adopt wearing a mask when we're not sitting in our own rooms in our own house. And so that if all of us were sitting in the studio at the same time, it would be best if all of us were wearing a mask. A lot of questions going up about what can we do today in terms of treatment, and we're learning more about that. Right now, the main things we're doing in the hospital is what we call supportive care. We're helping protect someone's giving people IV fluids to keep them hydrated. We're giving them oxygen to compensate for problems with their breathing. Occasionally, this virus can affect the clotting system. It can definitely affect the heart in some individuals. So we do compensation for that. There is a couple areas in terms of what we can think about in terms of treatment. There's a lot of press and a lot of discussion about this one medicine, chloroquine or hydroxychloroquine, medicines that treat malaria. Right now, we have very little evidence that this actually are beneficial, although there are some studies which are looking at that in more detail. And I think in another 2 or 3 weeks, potentially, and certainly within 6 weeks, we'll have a much better idea whether there's going to be benefit from hydroxychloroquine or chloroquine. We are doing several studies at UMass right now, looking at 2 different antiviral medications. One was a drug which is was studied for a number of different kinds of viruses, including SARS. It's called something called remdesivir, and that appears to be preliminary results which suggest that this is going to be beneficial. Although, the best way to do a study is something called a double-blind placebo-controlled study, where you take people and randomly give half of the individuals a drug, another half you give them placebo, and neither the patient nor the doctors know who is getting the placebo and who's getting the drug. You do complete trials and complete the treatment for the individuals, and then look and see who's doing, how well people have done. And those studies are just getting completed right now for remdesivir. They're doing data analysis much faster than they would usually do it, and we'd hope within another 3 to 4 weeks we'll know whether there's information about that. Another thing which has been done historically since the early 1900s, is giving someone the blood or giving the plasma and antibodies to someone who has had an infection, recovered from this, what we call the term of someone recovering as being convalescent. And we look at the part of the blood which is called, which has the antibodies, that's plasma. So we're talking about convalescent plasma treatment. This has been studied in China. This was actually used in the 1900s to treat pneumonia, and was shown to be effective in helping treat pneumonia then. So we're hopeful that this kind of treatment could be beneficial for treating COVID. We've actually just this week enrolled our first patient in a study at UMass, giving them convalescent plasma. And so there's other studies being done around the United States. This is part of a collaborative study being done nationwide to see if convalescent plasma can also be helpful in terms of control of treating this infection. Finally, I guess one of the big issues coming up is what's going to do in terms of testing. And what the Congressman McGovern said is absolutely clear. We need to have much more testing done in the community to understand what percentage of us have actually been experienced this infection. Probably it's going to take having 75 to 80% of the entire US population having protective antibody to this virus to really protect us and really can fully control this outbreak. And we don't know where we are. We don't know whether it's 1% or 5% or 10% or more of the population has had the infection so far. And that's really going to help guide what we need to do going forward. So that's just some perspective of what's going on in terms of what we know right now about this virus and in terms of treatment we can do in the hospital.
Thank you very much, Dick. Thanks a lot. That was a great overview to really give us the basics as well as that what's going on in the current arena. Now I'm going to ask Dr. Waqas Qureshi, our cardiologist, that he can give us how this virus affects, because there have been cases of sudden death also, which may be somewhat related to cardiovascular system. So you can give a perspective. And then, of course, our community is interested that how was his experience with COVID. So Dr. Qureshi.
Well, first of all, I'd like to thank you. Thank God that I'm still here. Then I'm talking about something like this, going through the experience. And I'll also like to thank the Congressman and our CEO, who has done a wonderful job, and Dr. Ellison. You know, he even emailed me during this time, and then Dr. Ramazan and the rest of the community that has helped me. So I have some slides prepared that I'm just going to go over. It might be some repetition with Dr. Ellison's talk. So we know, I just wanted to go over the timeline. You know, it's how fast this thing spread. As you can see, on December 31st, I don't know if the slides are on there. Are the slides on there?
Yes. Yes.
Okay. So as you can see, then December 31st, China alerts WHO to several pneumonia cases. And then by January 11th, they announced their first death. And as you go down, by February, there are cases in Egypt and other places in the world. And if you look at the US timeline, we started to have around, by the mid-March, we started to have some cases. And then, as you can see, mostly in California and Seattle area, and then Illinois, New Jersey, New York, and then you see all the states getting infected afterwards. And now almost more than 500,000 of people are infected. I wanted to talk about a little bit about this, that COVID-19, why is it important that we are talking about this, is because the number of deaths per day or per week, if you look at that, they're way more than other causes of death. I saw a cardiologist and people on Twitter and online, as well as on the TV, talking about that this is not a problem because other causes of death are way more significant than this, but they are not so significant in such a short period of time. So the symptomatology they talked about, Dr. Ellison was talking about that as well, but these are different symptoms. I wanted to go over my symptoms so that the community knows what happened to me. So day 1 and 2, I was breathless, on walking on 1 or 2 flights of stairs, and I can walk 5 or 6 flights of stairs without having any issue. And I did have diarrhea as well. And then on the second day, I became really weak. I slept for 16 hours, started having mild fevers. I had a hunch, or doctor sense that I probably got it. So I went, and it's a wonderful thing that Dr. Dickson has done, that there was a tent outside of the ED, and they took me right away in there and checked me. And the next day the results were out there. I knew my result, it was positive. And then I started having fevers, severe headaches, severe pain all over the body, and it kept on going for 4 or 5 days. Then I did get some encephalitis, which means I did get confused. I started having nerve pains, which I never read that they happen in this syndrome. But I started having severe pains all over my body. I couldn't remember a couple of days. I even passed out one day in my bathroom. My wife is a physician at UMass. She got really worried. She took me to the emergency department. I was having bruises on my body. So my blood counts were low, but because I was maintaining my oxygen levels and my chest X-ray was normal, so I came back home. And at home, I was in a room, locked in the room. My wife would drop stuff outside. She took really good care of me. Even then, my wife, my parents, everyone got it. And they never told me until like day 13 or 14 when they started having fevers. I lost my taste and smell around day 5, and it came back around day 15. Initially, the taste was really bad. Of everything, I felt like the taste was different, and then started getting better afterwards. And around day 18 and 19, I finally got rid of my fevers. I had fevers for 12 days. I also had bleeding from the nose, like large chunks of clots coming out, which was just one day. And all during this time, I lost around 13 pounds of weight. So just want to talk a little bit about the heart-related issues that can happen with this. So initially, as you can see on this slide, there's early infection. The body responds to the viruses when the virus enters inside and starts making immune antibodies that you have heard, or the chemicals in the body that are meant to destroy the cells where the virus is. And when that starts happening, that causes a lot of collateral damage to the rest of the body, especially the lungs, the hearts, everything gets inflamed. And that usually happens after 10 days. Initially, the fevers might be mild, like I had it, severe weakness, something like that, but then it gets really bad after 10 days. And there are different types of conditions. Some people get mild disease. Most of the people get mild disease, as you can see on this slide. Severe symptoms happen in 10%. Critical symptoms can happen in 5% patients, and they end up going to the ICU. It's wonderful that we are still at UMass. We have capacity to take more patients. So just a few controversies that have come up. There are many patients on blood pressure medicines like losartan, lisinopril. They end with sartan or pril. There was a controversy that because the virus attaches to the cells through the same switch, I would say, or plug, with which these medicines are attached and go inside the body. So that there was a worry that this might cause more infection, but it has not. My mom had this, but she had a very mild symptoms. She was on one of these medicines. So major societies have told the blood pressure patients not to stop these medicines at all. The other things that it can do to the heart is that it can cause rhythm problems. People can feel palpitations. Their heart might be racing. It may cause inflammation of the heart and damage to the heart. That's the most common type that we are seeing. And very, very rarely heart attack can happen in these patients as well. The other thing that Dr. Ellison also talked about is hydroxychloroquine and azithromycin. And, there was press conference around like 19th March, and there was increase in use of hydroxychloroquine and azithromycin. And some of the physicians, as you can see on this slide, that on Twitter, they said that it's not a good idea until we have some data available. And there was a man who died in Arizona who was taking some form of chloroquine that was used in aquariums. And most of these, as you can see, Eric Topol is a leading expert of heart. He mentioned that we need studies and research studies to show the evidence of safety and efficacy before going on and using this. So at the moment, it should occur in the context of clinical trial or studies, and use outside of that should be on the direction of the infectious disease specialist or COVID expert. And cardiologists should need to look at the ECG, because some people have heart problems, and they can, if they take these medicines together and they self-medicate, they can die actually suddenly with this. So that's what mainly I just want to talk about. If there are any questions, I'll be happy to take the questions at the end. And thank you again, everyone. Really wonderful team and community. I'm so happy moving from North Carolina to Massachusetts. I feel blessed. Really blessed.
Thank you very much, Dr. Qureshi. We wish you great health, and I'm glad, finally we are seeing each other through this video conference. And I know we have spoken several times, but I'm so happy you went through a lot, especially with your parents, elderly parents, young kids. So God bless you. You are in our prayers. Now we are going to open up for questions and answers here. We have a few questions for Congressman, so I'm going to start with him. Congressman, the question is that why Dr. Ellison talked about masks. And the question is that why government is not mandating to have masks for everybody when they are out, so they can protect themselves and they can protect the community also. And then also, when we talk about testing is still not easily available. So how we are going to lift the lockdown?
Yeah, well, those are good questions. Look, if the medical profession believes that we should mandate masks for everybody, we ought to. And the president ought to call for that, and the governors ought to call for that. And in terms of testing, we need more testing. I mean, it should be testing. We need to know who's been impacted by this disease, who is carrying this disease, who has the disease but is asymptomatic. And it has been, I don't want to get into a political discussion here, but I really am. While I'm pleased that Democrats and Republicans in Congress have come together to respond to the, with providing resources, I am frustrated with the president. He pushes, certain medications for people to take that are unproven. And as Dr. Qureshi has just pointed out, I mean, we've had people who have followed his advice and died. He says that we should wear masks, but he's not going to wear a mask. He says that everybody's, testing is great. And then, we know that's not the reality. He said the other day that he's going to make the most difficult choice of his life, and that is to decide when and how our economy and our society reopens. And then what he does is he says, the governors are going to do it, and they'll be held accountable. Look, we need federal leadership to provide the resources to support the governors, the medical professionals, to provide the tests and to be able to process those tests. And I really believe that. And, I think if there was the political leadership in the White House, Congress would provide the resources. This is not, we have the resources to do this. This is about political will. And I don't, for the life of me, I don't know why the hell it has taken us so long to ramp up the testing. And in any event, I understand the question. There's no easy answer. I think it's going to be up to individual states to take the lead. I'm sorry to say that. And and they're going to have to put pressure on us to make sure we provide them the resources to do the extensive testing.
I'm going to take a little bit. Thank you, Congressman. That was great response here for Dr. Asif Hirani, because we talked about medicine in general, but I will ask our Imam, Dr. Asif Hirani, about the spiritual role. You know, we talked about spirituality, meditation, yoga, all these things, being with different faiths. We all have a component over there. How Dr. Hirani has been at the forefront. He, in fact, wrote a big research paper about the general aspects of the COVID, because there are different ramifications in the society, you know, the burial rites, the funeral and all that, which we may not be directly encountering, but those are the issues which families face. And these are very tough situations. But how people can really keep their anxiety level, you know, what they are going through. So the role of spirituality, Dr. Hirani, please.
So first of all, I would like to say special thanks to the Congressman, to the CEO, to Dr. Ellis, to Dr. Waqas. I'm so glad I'm smiling face again. And again, Dr. Ramadan, you are amazing in this. You must have a night, your TV show personally. Now you should actually you should have a TV show like a Sean Hannity show or Anderson Cooper. But just briefly speaking, I'm not a medical doctor, so I cannot advise you from a medical perspective. I would just first of all, invoke God Almighty, that may God Almighty remove this virus from the face of the earth so that we can go back to our routine life. And may God Almighty protect all of us and our loved ones and our community. Just one aspect, I was talking to Dr. Mohsena Alam, who was a pediatrician last week, and she was saying that usually the people who are struggling with the coronavirus, like Dr. Waqas, that 85% is physical and 15% almost psychological. So she asked me to advise the congregation to get mentally strong in terms of spirituality, in terms of keep fighting. A true believer, you would expect a true believer to fight until the last breath and not to give up. So this is my advice. Think positive. There are so many reasons for you to think negative at this moment, but keep thinking positive and keep fighting. And hopefully, inshallah, good days will come, inshallah.
Thank you very much, Dr. Hirani. I know that was very brief and sweet. And I know prayers, and that keeps you at the, keeps your faith also intact, and then gives you some boost from the inner side, how to fight these type of situations and calamities, and keeps your anxiety level low without using any other chemical. So that's great, and thank you for your efforts. I know that many people resisted, but after consultation, what the guidelines were from the DPH and the government guidelines at the state level, how you had played an active role that how we can save our community and other people, and how we can bring the center with the less activities. These were tough decisions, but you guided us. That was wonderful. Thank you very much for that. Now, there's a question for Dr. Dickson here, that how is our center doing with personal protective equipment, and then a lot of, the surgeries or procedures being down, then overall the system may be having a lot of financial hardship also. And at the same time, they may be converting, areas for making them negative pressure rooms. That brings the expenses. How you are balancing that, and how government is helping you with that also?
Well, our number one priority during all of this is to keep our caregivers safe. And one, obviously, because we don't want our people sick, but they're your most vital resource in taking care of patients and being able to keep up with the disease burden that is coming into the healthcare system. So early on, we had a lot of troubles with PPE and the personal protective equipment, the N95 masks, gloves, eye shields, and the drapes that we use to keep people protected. We're doing much better now, in part because we have had some influx. We've chased down every lead Congressman McGovern was talking about, and my uncle in China can get us these masks, and elsewhere in the world. So we're able to keep up, and we still conserve. We still reuse our masks 4 times before, and sterilize them before we change out. I work every Sunday night in the COVID tent that was described, in testing folks that come in, and I'll use my mask 4 times, have it sterilized in between by UV light, and then I'll get a new one. And so we're doing okay on the PPE now. It shouldn't have been as difficult as it was. And I think what Congressman McGovern said, is exactly right. For a small healthcare system or even a big healthcare system like ours, trying to figure out who you can buy from and who you can't, that's why we have government, right? And that's why we have an executive branch, because they can act quickly and do things either to help us get what we need from out of the country or to produce what we need here. And that, one of the most disappointing things in the early phases of this, but we are doing better. The finances will not be good this year. And I've said this in an interview the other day, in any disaster, including this one, poor people do worse. They have less reserves. And we're seeing it right now in our own communities and certainly in the Boston communities. If one person gets sick in many of our families, you can quarantine to a section of the house. Well, if you're living with 6 people in a one-room apartment, there is no ability to quarantine. Everybody's going to get the disease. And the same is true for hospitals that take care of the poor and the safety nets. And one of the things that has been most concerning for me, there were hospitals that were just hanging on. Lawrence General, Holyoke, the Brockton hospitals. Before this happened, I don't know how they're going to make it out. And so both at the state level, Governor Baker's first bill focused on shoring up the safety nets, the high Medicaid hospitals, which I think was great. And then in the first stimulus bill that had the $100 billion for hospitals, that was primarily focused on hospitals that had a high Medicare percentage. And so the Mayo Clinics of the world, or the partners of the world, will probably take a bigger hit in all of this than we will, because the government has focused on strengthening the safety net, thankfully. But it's still a lesson to be learned when we emerge from this, is that, boy, those hospitals that take care of the poor are the most vulnerable when something like this happens. And we'll do okay. We'll make it out of this. But I am worried about a lot of my colleagues that run safety net hospitals around the state.
No, I think you have done great leadership here, and I know these are tough times, and you take the burden, not taking care of the patients, but how the system is working, and then how overall the employees, get them their paychecks also, that they are all happy and they cannot be worried about anything else at this time when there is so much else going on. So let's hope, as you rightly said, that we can pull through this together. This is a unique time. The last we are hearing in our history, this is not in our age time, it was 1918 when something like this happened. We are all younger than that. We'll be talking to our children and grandchildren when one time this happened. But let's hope that this is not going to be repeated, which is the worry, which I think I'll ask Dr. Ellison my next question, that, there is this concern that there may be mutation of the virus also. And then this may be second wave coming, or in fall we may have another thing. Then there are like a Harvard prediction model that it may go beyond 2020 also. So people are quite concerned. And then I will do some follow-up questions with you, Dr. Ellison, once you address that.
Yeah, I do think that there is a concern that there will be a second wave. If you look back to 1918, we're actually quite odd. Turns out that my grandfather was a physician, and he started his internship in the summer of 1918. And during his first month as an intern, he had 240 patients that he admitted to the hospital, of which 40% died. So that was in 1918. They had that experience, and it came back again about 6 months later, and then again about a year later. Part of that is because there is some seasonality to the viruses. There tends to be viruses, the cold viruses, and the coronavirus is a kind of cold virus. It's related to the common cold viruses. Tend to be disappear during the warm summer months, but they will then return if it's still present in the community. And unfortunately, this can continue to stay in the community until we actually have a large percentage of the population which is immune. And when you get a large enough percentage of the population immune, we have a term called herd immunity, and that means that if the chance of spreading it from one person to another goes down, if you're standing around, you have the virus, and you're with 10 other people, and all 10 of them do not have antibodies, likely 4 or 5 people will get infected. But if you're standing with 10 people and 8 of them are already immune, you really don't have to worry. It's very likely that no one else will pick it up again from you. So we need to be in a situation where a big part of the population has immunity to this. That's going to take a while. So there's a real concern that we'll be able to get this under control with this wave now. And I really do think everything seems to be turning around well nationwide. And that's what we've seen in South Korea and other parts of the world. But it can come back again. And we'll just have to watch and hope that we can keep it, that when it comes back slowly and not as a big sudden surge.
Got it. There are 2 other questions for you, Dr. Ellison here. One is, I think you already addressed, are there any clinical trials going on at UMass for COVID-19? And which you mentioned, but if you want to add something more, that's fine. And then there's another question from one of our physicians, actually from UMass, that, with SARS virus, it may be circulating. What are the chances it was circulating in the US since January, actually? And then based on the current numbers of proven COVID-19 cases, what is the expected undiagnosed community members in our area here? Any input on that?
Okay, let's go back in terms of the 3 questions. Again, your first question is whether they're clinical trials. And yes, we've actually been doing a clinical trial of this one medication, remdesivir, which is a double-blind, placebo-controlled trial. We've actually enrolled, I believe, 27 patients at UMass. That study will be closing in the next several days. They'll have a large enough number of people have been enrolled nationwide as the study is finishing up. But we're just starting a second trial right now, the coming week, of something called favipiravir, which is a drug which has been studied and it's actually licensed in Japan to treat influenza. And there'll be a study done here at UMass as well as the Mass General Hospital to look at that particular drug. And then, again, we're also, as I mentioned, doing the study of the convalescent plasma. Again, this is the antibodies from someone who's recovered from the infection, taking blood from them and then giving it to someone else. So those are the 3 trials we have present. There are several other trials that have individuals have approached UMass to try and participate in other trials, but those are the 3 which we currently have in place right now. You have to remind me of the other 2 questions.
Other question was that what are the chances that we had COVID circulating in the US since January even, and then how we are going to, any estimate about the undiagnosed number of community members here?
Well, it's actually related. Actually, we probably did have COVID circulating in the United States for at least 3 to 4 weeks before actually it was first recognized, and they had the outbreak in Washington. There is slight mutations of the virus. This virus, as it grows, can change slightly over time, and you can, if you do a lot of mathematics in doing this, you can look at the rate of change, how quickly a virus will pick up new mutations. And going back and looking at what they saw in Washington, it looked like it had been present in Washington for at least 4 weeks and probably 6 weeks before it was identified. So there had been, before the shutdown of individuals coming from China, there's a lot of people going back and forth between the United States and China. So probably it's likely that it certainly was in the Pacific Northwest, and I suspect it was in New York City as well, beginning sometime in early January. And why it exploded so much in New York is because at least half of the people who acquire this virus are asymptomatic. So they can be walking around giving it to literally hundreds of other people and not be really having any symptoms at all.
Right.
So that really offers the opportunity for a lot of spread.
Right. And I think it's hard to estimate the undiagnosed number from our current small data that we can't extrapolate in our communities as such. Because
At least you can easily double it. For every case we know about, there's at least probably minimum of 1 other and possibly 2 other people for every 1 case we actually make a diagnosis for.
Are we, expecting, as Dr. Dickson, that these 2-3 days maybe that we are reaching our peak in Massachusetts, hopefully, and then we see a plateau and going down?
Yeah, actually, one of the things that's been going on, we've been doing a good job of social distancing, and that's slowing things down. Seems paradoxically, when you slow things down and spread things out a little bit, the peak may actually be pushed out a little bit. So the peak now is going to be, they thought last week it was going to be peak was in 10 days. Now we're still saying the peak is going to be another 7 or 8 days. So sometime, about the 27th, 28th may be the peak for right now in Massachusetts.
Okay. Thank you. Dr. Qureshi, there are quite a few questions for you. One is that, were you tested after you recovered from it? And then how many days after that?
You're on mute,
Yes,
Qureshi.
So I have not been tested yet, but I was. Dr. Ellison can probably also comment on it, but it seems to be people would stay positive for COVID up to 6 weeks after getting the COVID. And I was looking at a Nature Medicine paper recently that the infection or infectivity, which means you give infection to other people, is much higher in the beginning, but then afterwards, even infection to other people is not there. So at the moment, if the symptoms go away after 3 days of symptoms, people are saying that you have this, everything is resolved, and you're not at risk of giving infection to the other people. And there was I read something from CDC that they asked for having negative tests on one day, and then next day check it, and they check it again. If there's a negative test, that's when they get cleared. But at the moment, really, the answer to that is not very clear to me, at least. I don't know if Dr. Ellison would like to chime in and say something about it.
Yes, Dr. Ellison, is there a hospital policy for that?
Yeah, so this is an area which is a lot of is learning a lot. As Dr. Qureshi just said, there's been recent data, that looking at when people are most likely to be infectious, which is really early in the course of the illness. There were a number of studies looking at the question of how long does the virus stay in the body. And there are two ways to look at that. One is to look at the presence of whether or not there is a live virus that can be given to someone else. And that's why basically you can can you take a sample of virus and actually grow it in cells, which would be a way to say it's going to be able to grow in someone else. And in that situation, it seems like no one has yet seen that they could identify growing the virus beyond 7 days. I'm sure there's going to be further studies looking at that question. But from the time of symptom someone first develops symptoms until you can actually still grow it, seems to be about the first week after that. Why is that? Could be is because actually you begin to develop antibodies. About the time someone has begun symptoms, you're already starting to have some antibodies develop. And a week later, you're going to have higher levels of antibody. And the antibodies should be able to help prevent the virus from growing. We talk about having antibodies, which we call neutralizing antibodies, which they neutralize or stop the virus from growing and infecting other individuals.
Okay.
Having said that, one of the things that you can also do is look for the presence of the virus RNA, and look for that. And we know for a number of different viruses that viral RNA can persist for a long time. The study is being done actually for Ebola, a terrible infection which took place in Western Africa. They found that individuals who usually it took about a month to 45, 50 days for someone to still have the virus present. But in men, they were being tested because they could find that the virus happened to be in semen. And sometimes some of these men they'd still find the viral RNA for that virus in semen for 6 months or more, although it did not appear to be infectious. Part of this is the body, when you kill the virus, you're being left with the viral RNA present there. And the body has a housekeeping function to sort of clear out all of this, foreign RNA. It seems the body does not necessarily do a good job of getting rid of some of this material. It does seem that every day after the first couple of weeks, first day or two, the viral load begins, the amount of virus drops off. And after really 8 or 9 days, there are very low levels of viral RNA present, but they can sometimes stick around for up to 3 to 4 weeks out after that. And so we're still learning exactly how long it's present. People who've got a normal immune system probably are going to only be able to control this, and really we don't think there's going to be much concern after the first week. Someone who's a cancer patient, for those individuals, probably want to be much more cautious about saying that when they're going to be having the virus under control. And those people we probably do want to do testing for.
Got it. I think you answered one of other questions also, that how long it takes to not to shed virus, so that is covered in there, and then how these swabs can be positive even after your symptoms are gone, or they may be negative. So I know there are a limitation with this test. Dr. Qureshi, there are other questions for you. That did your family members have the same type of symptoms, and were your symptoms categorized as the severe symptoms, and were their symptoms as severe or milder?
So the milder symptoms of this disease are in usual terms are a little bit kind of not really mild, but the severe means you are on ventilator. So you're going on a ventilator, you're in the ICU. So I did not have severe symptoms. I would categorize it maybe mild or a little bit more than mild. My family members had mild symptoms, and we managed everything at home for them. We checked their oxygen levels. My dad's oxygen level dropped down to 90%, but then it came up with some breathing exercises within a day, so we didn't go to the hospital. My mom had fevers for 10 days, and then she recovered after 10 days. My wife, she also had some symptoms for 6 or 7 days, and then she recovered. She did get tested on the 4th day because she works at UMass, and the employee health was really on top of us, but she tested negative. But she did have symptoms for around 11 or 12 days. So I don't know if it was really positive or not, because she was the only one who was in really contact with me. And hydration is very important in this. I mean, that's what we did at home, and Tylenol around the clock, which means all the time, every 6 to 8 hours, we were taking Tylenol, and that's what we did. So I don't know.
This question is for Dr. Dickson. I know we are going over the time, but I hope you guys can just stay a few more minutes. Maybe by 9:15 we'll wind it up. This is for Dr. Dickson. That can you discuss the effort UMass is taking to keep family informed when their loved one is admitted, since there is a restriction on visitation at the hospital?
Yeah, one of the great challenges for our patients is they're sick, they're isolated, and they don't have the people that love them nearby, and the people that we love. And so we've taken a lot of extra measures to try to keep a connection between our patients and their family, primarily using the same mechanisms that we're using here. So we have iPads that we put into almost every room now if a patient doesn't have their own device, and work with them to teach them how they can do FaceTime with their loved ones. And it's just such an important part of the healing. And we've talked a lot within the organization about trying to make that human connection with every patient behind the mask and behind the goggles and your blue gown. And I think the team has done a remarkable job of doing different things to make sure that they know we're still caregivers. We still are working to get you better. Many people have posted their picture on the outside of their gown so that the people know what we look like behind our masks, and I think it's a wonderful way to do it. So we're acutely attuned to that, and then doing everything we can to keep that connection.
Excellent. No, thank you. Dr. Ellison, actually 2 questions for you. That if there was a place occupied by a COVID positive patient, how long it remains positive? I mean, is there a time that then you can safely enter in that space? And also that what is the truth in WHO warning that there is no evidence antibody tests can show coronavirus immunity?
Well, one of the concerns is that if someone is extensively coughing or doing things through certain kind of medical procedures, which we'll do, such as putting a breathing tube into someone's lungs, where that we worry that that will cause someone to cough and put large amounts of virus into the air at that time. Under those circumstances, there is a concern that someone walks into the room that that someone could breathe in the virus. We rely a lot on our facilities department there. They have a very sophisticated air handling system, and they can tell us how much air is going into the room, how much is going out, to how much time it takes for us to basically change over all of the air in the room. And we usually then, if someone's doing a lot of coughing, we'll say that we want someone to stay out of the room until all of the air has been turned over. So we can calculate the amount of time that takes using some formulas, which I do not calculate, but we just rely on our facilities people and a couple tables to sort that out. So that is become a question. The question about antibodies is, we do think that there are antibodies which will be protected. The problem right now is developing a test which will tell us that those antibodies are there. Doing the precise test to say exactly that a virus is going to neutralize or kill it. Basically, you have to have the virus, mix the antibodies with the virus, and then see if it stops it from growing. That's obviously requires live virus. It's technically very difficult to do. You do that in a research laboratory. So what we want to do is do a blood test and see if we can get the same information from a simple blood test as we could do from doing that kind of test. And what we're waiting for right now is to develop the antibody test, which will give us that information.
Got it. Again, there are more questions for you, Dr. Ellison. That one question is that how does hydrochloroquine and azithromycin work together to fight the virus? What mechanism? And also, I think the question was about convalescent serum, the antibody. So you already addressed that. So maybe you can first tackle that. Then there's other question which I will address.
Well, so azithromycin and hydroxychloroquine, neither of them were directly developed to ever treat the virus, and neither of them have very strong antiviral properties. They do some things to cells, the human cells, which makes them somewhat inhospitable to make it, so the viruses don't grow very well inside of cells. And so in the laboratory, there's some studies which suggest that by taking these medicines, it makes it so the cell changed in the body cells so that the virus is not going to grow very well. That may work very well inside a laboratory, but to say it's going to work in terms of human beings, we need to do clinical studies about that. And also, when you do something like this, you may need to give such high concentrations of these drugs that they could cause bad things to happen to a body. Dr. Qureshi would know that both of these drugs can have an effect on the heart, and it could be that the big balance, you don't want to give something at such high levels that you're going to impact someone's heart before you have any effect on the virus. So we need to do clinical studies before. I really don't feel it's safe right now to give these medications to treat this virus until we know more about, do a very good controlled trial to say it's really going to be worthwhile.
Dr. Ellison, question is that, is there any concern that 1 week after somebody recovered from the COVID, and still there can be a concern that they may pass on the infection to others?
Yeah, that remains a concern about this. We do think that someone who has a normal immune system and has not had trouble with that, it's going to be unlikely that that is a possibility. Someone who has a very impaired immune system, who's undergoing cancer chemotherapy or might have had organ transplant or taking very powerful medications to suppress the immune system, we don't have as much information about that situation. So that as individuals, we need to study more and get more information about.
Well, I think there are a lot of questions for you. Let me just quickly ask Dr. Qureshi that somebody asked you, did you take any medications? Which ones do you think they were beneficial?
Well, I just mentioned Tylenol and a lot of Gatorade and electrolytes. Some of my ICU friends who are working in ICU, they are seeing a lot of electrolyte abnormalities like low potassium in these patients, and they're having cramps. So that's what I did. I did take a leave as well because the fevers were not going away. And then I did take vitamin C and zinc, and that's all.
I think people were worried about Aleve and ibuprofen or NSAIDs to be taken.
They were, but now the data says that that's not true. So,
right.
that's false alarm.
Here's a question, Dr. Ellison, that my wife and daughter got infected and both recovered. I tested 2 times and came negative. What does this mean? I hope he was negative.
Yes. That becomes a question now, which we're also trying to look at in terms of no test we do is perfect. There's always going to be tests for people that are, we call false negative or false positive test results. To be able to test the virus well, there needs to be a relatively high level of the virus present in the nose. The usual test we do is by sticking a swab to the very back of someone's nose. We do think, doing some recent studies at UMass and looking over our experience, that test does seem to be very, very sensitive. And we do think that probably the chance of somebody having a false negative test may be less than 5%. But it's still possible that someone could, in fact, have it, but be in the 5% of people that it came back negative. But hopefully the person, this individual actually got through and did not get infected. We know that not everyone exposed to someone is going to get infected.
Got it. We have one more question for you and then 2 for Congressman, and then we will, I think, close the questions. So the question is that the difference between, along the same lines, that between RNA test and rapid antibody test, and how long after exposure they become positive, Dr. Ellison?
Okay, so the RNA test is a test for the virus itself in terms of the RNA virus. So someone gets exposed to the virus, it seems it takes a little while for the virus to begin to grow. The average time for someone to develop symptoms after exposure appears to be about 4 days. So if someone gets tested on day 2, they're likely to be negative. Day 3, they may very well be negative. Day 4, the day they develop symptoms, you're probably going to be able to find the RNA. We don't know whether we can find the RNA, how much earlier before symptoms we could find it. So we can't really say that. But once someone has symptoms, we think there's probably more than 95% chance we'll be able to find it with the RNA test. The antibody test is a test for our body's ability to make the antibody, these small proteins that would actually attack the virus and protect against it. That usually takes our body 5 to 7 days to begin to develop it after someone has an exposure to a new virus for us to begin to develop new antibodies to that. It does seem that many individuals are beginning to show evidence of antibodies within the first day or 2 after symptoms showing up. And so so there are 2 different, one test looking for the virus and the RNA, the other one's looking for our ability to fight the virus and our ability to reaction to it.
Great. Congressman, 2 of our community members, Tahir Ali and Hassan Usmani, pass on their greetings to you and thank you for joining again. So their questions from 2 other people are that, there's a plan the government is going to reopen and how community can really work around and participate, or what should be their response with premature opening. And May 4th, is it a realistic date to reopen the schools when the school year is almost over?
Well, again, I defer those questions to the scientists and to the medical experts. We all want the economy open right now. We all want to go back to normal, right? I mean, that's a natural feeling in the middle of this crisis. But if we re-engage, if we go back to business as usual too soon, this could spread again, and we could be back, at square one. And so it is important to listen to those who know about this disease and about these viruses. And those are the scientists and the medical experts and the doctors. And I will just say this: I'm concerned. In recent days, we've seen this proliferation of protests around the country about pushing governments, state governments, to open up, even when these states, many of them haven't even had their surge yet. And I'm doubly concerned when I saw the president's Twitter today when he's tweeting "Liberate Pennsylvania, liberate Minnesota, liberate Michigan." I mean, that's just irresponsible. What we need to do is we need to open our community up. It'll probably be gradually, and we're not going to get back to normal like it was before this started anytime soon. And I'm not sure what the decision is going to be made about when the schools are going to open. The governor and our mayors and our city managers are going to make that decision. But we don't want to do anything prematurely, even though we'd all like to have it happen right now. So, I mean, let's be responsible. Let's understand that this social distancing, as we've heard from our doctors here today, is having an impact. And so, let's follow this all the way through, so that when we reopen up again, we don't find ourselves, a few weeks later back where we started here today. And again, we don't know. There's still a lot about this that we don't know. We don't know what's going to happen in the fall. And so we one of the things we also should be doing right now is learning from the mistakes that occurred leading up to dealing with this virus, and trying to get a system in place where the federal government is actually more responsive to the states and local communities, so that if we see ourselves in this situation again, maybe in the fall, we can respond better, more quickly, and more effectively.
Perfect. No, thank you very much. Dr. Dickson, last comment, being part of the Worcester community and being part of the UMass Memorial Healthcare myself, we would like to know how Worcester Islamic Center can really participate or can play a positive role, or same for Congressman McGovern, that how our community can play a role. While we are having our own internal issues also, but if anything we can do, anything which you need from us, which we can help out, please let us know about that.
Absolutely. Well, I think what you're doing here tonight, education, spreading the word of the importance of continuing social distancing, wearing a mask whenever in public, not trying to press the opening of the state. And there was a question about, is May 4th realistic for going back to school? I will tell you, my answer would be no, and we're just not ready yet. And the use of technology, as we've had here today, we've had a wonderful meeting. We've been able to share knowledge and have speakers maybe that we couldn't always get together. So I think you're doing all the right things, and I think you're getting information out to your members such that they understand what they should do when they get sick, when they should be tested. And as things evolve, and things will evolve, and we start to get to immunity testing, the antibody testing, continuing to get the new information out to people. There's so few trusted sources of information, and I think the faith-based organizations are one of those places where people feel safe to get their information. So you've got a wonderful group of physicians and that working with you, and we're someone you can call upon for any advice. And Dr. Ellison, the absolute expert. And I learn something every time I'm on a panel with him. So thank you, Dick, and thank you, Congressman McGovern, for all you're doing on behalf of us.
I'm in awe of all of you, so thank you.
Before I say word of thanks, I just wanted to share with you that our Ramadan, which is the month of fasting, is a 30-day of fasting from sunrise to sunset, is actually beginning next Friday. And every day, actually, we have a gathering where hundreds of people come to eat together to break the fast, and then we have the prayer services after that, and literally hundreds. So it's very hard on us that we are obviously in isolation, and if government opens prematurely, that can be another concern, and exactly that's how it can spread. Same with the schools or any other activities. So let's hope that the decisions are made wisely and the guidance is there. And of course, we look forward to our experts here also. One last announcement is that we are in fact going to have our annual virtual fundraiser, which will be next Saturday on April 25th. So I want to just advise and request our community to participate again along the same platform. So I know this, you must be thinking why we are talking about this, because we have no congregants who come every Friday. So we have to maintain and push the lights on, and all that expenses are still running and all that. So we have to meet our budget also. So we are working hard on that. So hopefully this fundraiser on next Saturday will be a good one, a virtual one. So at the end, I really thanked all of you. I know this is a time when you are all tired at the end of the day. Congressman, you drove, but you still joined us. Thank you very much for that, commitment.
Well, thank you. And we wish everybody, we want everyone to be safe, and we wish everyone all the best during Ramadan. So thank you.
Thank you very much. Dr. Dickson, thank you very much for your time and all, being together, really guiding us, leading us. And we look forward to continue to work with you, and hopefully we all will pull through it together. So thanks a lot for joining us, Dr. Ellison. That was wonderful. Thank you at the last minute. I know I pushed your dinner here also on the video. I'm sorry about that. But that was the commitment. Dr. Qureshi, good to see you again, and that you are recovered, and so far your family. You all have a wonderful night and many healthy days ahead for you and your families and everybody. So thank you very much for that. I really appreciate that. God bless you all.
Bless.
Good
Thank
night.
you all.
Thanks.